Hello, everybody, and welcome back to another episode of the Impact Farming Show. Today, we have an amazing guest with us. We have Briana Hagen. Briana, how are you doing?
I'm doing very well, thank you. How are you?
Good. I am so happy to have you on the show. You guys, we're in for a treat. We're going to talk about it later. This episode's going to be about mental health. But Briana has been an important player in this whole conversation of mental health and agriculture. And I'll tell you why. We'll go through her background and then we'll talk a lot about mental health and agriculture. So, Briana, are you ready?
I'm ready.
Okay. So, you guys, Briana is the CEO and lead scientist for the Canadian Centre for Agricultural Wellbeing. And I'm going to get you, Briana, to share a little bit more about your background and what you do now. And then we'll dive in and talk about the mental health survey and all the good work that you guys are doing.
Yeah, for sure. So I guess all of those things are very entwined that we've been involved in over the last, say, 8 years now. But yeah, so I am the CEO and lead scientist over the Canadian Centre for Agricultural Wellbeing, a newer not-for-profit that works exclusively with farm mental health. So we are a kind of grassroots to service provision organization that looks at developing evidence-based farm tailored mental health services for farmers in Canada. And all of that kind of came to be because of all of the research and work that started back in 2015 at the University of Guelph.
Excellent. So, way back, 2015, I think 2016, somewhere in there, you guys at the University of Guelph, there was two individuals in there. You guys did the national survey, and that really just, in my opinion, and memory of the conversation, that really started off the conversation of mental health in agriculture. So, can you tell me a little bit about the work you were doing? I really want to hear where the idea came from. Like when somebody starts a new business or a project, it's like you're sitting at the table, like, what's that story? And then how did that evolve where you guys said, we need to do the survey and start this conversation? So, can you tell me more about that?
So that story begins with Dr. Andrea Jones. So she is a veterinarian and an epidemiologist. And back in 2015, she started hearing from people in ag and farmers that she had worked with in her capacity as a vet about deaths by suicide that were happening in the ag community, which really surprised her. Her, like many others, we have this idyllic picture of farming and what a great life it is, and how fulfilling it must be. So she did a little bit of diving into, well, what exists in terms of mental health research for farmers? What's going on in the landscape? Is this a strange thing that's cropped up all of a sudden? And what she found was that there was no Canadian data that looked at farmer mental health at all. So, as a veterinarian and a trained epidemiologist, she decided it was time to get some baseline data so we could know what was going on. I came from a background of psychiatric epidemiology. So I had been doing epidemiology of mental health issues for years in different populations, particularly in the prairies and working with Indigenous populations. So her and I, through fate and through kind of an amazing coincidence, came together, and I got to work with her on this national survey that she had developed to look at farm stress and resilience. So we kind of took that bit of survey that she was looking to look at just Ontario, maybe get a couple hundred farmers to take this survey just to get a sense of what is going on in terms of depression, stress, resilience, anxiety, what's going on. And it blew up. It went national. There was over 1,300 farmers that took the survey. And I think at that point, we kind of knew, like, this is something that farmers and people who work in agriculture really care about. And there just wasn't any information. So what we ended up finding from that was that there were huge gaps that needed to be addressed research wise and programming wise. that farmers were experiencing things like depression, chronic stress, chronic high stress, anxiety, and burnout at much higher prevalences than the general population. So we kind of just went from there and developed a research program and program development over the last 8 years.
Excellent. I know way back in the beginning, probably season 1 of our show, I sat down with Dr. Andrea at the Outdoor Farm Show in Woodstock and had a conversation about this. And it was, I think, fairly new at that point, maybe a couple years
Mhm.
old. So it was exciting to see my conversation with her and the momentum it had already gained. And then now it's changed the industry. It really
Mhm.
has. I mean, we're in 2023 and it's becoming increasingly common to hear conversations about mental health, the
Mhm.
presentations, programming. It's made such a big impact. It's so cool. I want to ask you, how does it feel to be part of that?
It
Has anybody ever
feels
asked you that? I like those
no.
interesting stories. No, I just thought of that. I love those. I'm an entrepreneur, business owner, right? So you always hear the why I launched my business story and some of those little personal stories. And I just thought of that. That must feel pretty darn cool to be part of a movement that's changed the industry and saved lives. How cool.
Yeah, you know what? When you do stop and think about it, it is cool to be part of something that
Yeah.
I think is changing the industry for the better. I can't say that I've ever stopped to think about it very much. Things are very busy all the time, but what's really cool for me to see is the shift in conversation, and the comfortability of having those conversations from the very first presentation I gave about farmer mental health in a small meeting with 10 farmers and no questions after and not a lot of chat after, to now where we are giving presentations and people are asking good questions and saying, where can I get training to learn more about mental health so I'm better prepared if I ever have a struggle or my partner has a struggle or my neighbor has a struggle, that they feel like they can talk to me about it. That's where the conversation has gone. And it's wildly different than the conversations we were having in 2016.
Nice. That is so wonderful. Okay, so I want to chat about, and you've touched on this a little bit, and you've touched on how it's impacted the industry and increased awareness. But I want to go back and talk about those key takeaways. Hopefully you have those stats in your memory there when the survey was done, because one of my next questions I'm going to ask you about. I know you guys updated the
Mhm.
survey in 2021. So I
Mhm.
want to chat about the original survey,
Yep.
the baseline, because we've all heard those stats, but it would be great to go there and then slide over to 2021 and see how things are changing. So, do you want to talk
Mhm.
about the original survey and some of the takeaways?
Sure. So, yeah, I think I briefly mentioned that some of the main takeaways were that farmers were experiencing poor mental health outcomes at a significantly increased prevalence compared to the general population, in the 2015-16 survey. And then what we wanted to do in 2021 was look and see, has that changed? Has it remained the same? We added some questions around suicide that weren't in the first questionnaire, and some coping stuff into the 2021 survey. We tried to keep the first survey quite short and really hit some really key points. And then with the second survey, we wanted to expand a little bit to see how folks were doing. So in 2015-16, they were doing significantly poorer than the general population. In 2021, now this was during the pandemic.
Mm,
So that needs to be, we need to think about that too.
yes.
Um, However, everybody was experiencing the pandemic, so everyone experienced that differently. But within that survey, we found that farmers are still struggling. They were still experiencing these poor mental health outcomes. significantly more than the general population. And what we found was farming women were doing even worse.
Okay.
So when it came to all the mental health outcomes, except for um, one of the alcohol use, women were faring poorer than farm men.
Okay. Interesting. And I'm glad that you put the pandemic in there too, because I think that probably added 10 layers. If you
Yeah.
look at mental health, a big part of it, as you know, and everybody in the audience, connection,
Hmm.
community, getting out is um, a big thing for mental happiness, right? Mental health. And as we all know, we were locked down and all the crazy stuff. So I'm glad that you added that, because that, if you're on a farm and you're used to being part of a strong community, and if you're part of a farm and dealing with all the stresses of a farm, that just would have added, right?
Hmm.
Yeah.
Hmm. Yeah, definitely. So it was definitely a unique time to be doing a comparison survey, but our intention is to do it again, 5 year or 2026, every 5 years. We're hoping to do these updates to the data. And
Okay.
now I feel like the other thing to bear in mind is now, as we move to, say, the 2026 cycle of that, there will be some farm tailored services that are available that hopefully will start to break up those cycles a little bit, and hopefully we'll be seeing some improvements.
Perfect. Do you mind me asking? Because I didn't see the survey. You touched on coping and suicide. What were the questions that you guys asked? Do you know those off?
Around suicide,
Yeah.
we asked about suicidal ideation and
Okay.
suicide attempts.
Okay.
And we, for coping, we used a coping tool that was a validated tool that is used in the census data as well. So we were able to compare general population to farmers. And basically, it looked at positive or like healthy and unhealthy ways of coping. So things like um, when you're experiencing stress, do you go outside more? Do you lean on friends and family? Do you use alcohol or drugs? Um, that type of thing. So what we were finding was that the negative coping uh, farmers were using negative coping strategies more frequently than the general population.
Yeah, I believe it. Sorry, that's maybe a little bit.
Smoking was also in there.
Yeah, maybe that's a little bit pessimistic, but I'm a farmer too, so I get it.
Hmm.
Everything, you know, when things are so out of control, you want to find control and coping mechanisms where you can. So, not, I have no experience in this other than just, observing people in life, right? So, if things are hard, your coping mechanism comes in to give you that sense of control. Is that?
Yeah, yeah, exactly. Yeah. So, or even just shutting down or not speaking to others, putting
Mm,
yourself in kind of isolation, that type of thing can happen as well. So, yeah. So we'll those also, learning about that gives us a place to start when we're developing intervention.
okay, excellent. Okay, I'm going to put some links in the show notes, but I'm sure there's individuals that might want to go check out the
Yeah.
surveys. Is there a place that they can do that?
Yeah, absolutely. So we did publish right out of the survey. So there is a link I can send you to an open access article that everybody can see.
Okay, excellent. Because I'll put that in there. I know we've chatted about this and farmers have seen the data. It would be excellent for them to be able to go there and read it if they're interested.
Yeah, absolutely.
Perfect. So, if you don't have anything else you want to add about the first survey, the second survey, I want to ask you about now. We're in 2023. I see that you are with the Canadian Centre for Agricultural Wellbeing. Is that
Mhm.
an old organization, or did that come about because of this work that you guys are doing?
This came about directly from the work that has been done over the last 7, 8 years. So
Okay.
the center, actually, if I step back one further, so those surveys happened. In between that, we also did a huge qualitative study where we did 75 one-on-one in-depth interviews with farmers about their mental health
Oh,
and
wow.
how they experience mental health. what it means to seek help for their mental health, how they maintain it, what gaps there were, what barriers to seeking help there are. So that all informed our next stage of our research. And then it also informed the Guelph Statement, where I don't know if you heard about the Guelph Statement, but basically, folks from agriculture from across the country were invited to Ottawa to speak about the importance of agricultural mental health. And the government put forward the Guelph Statement that indicated that farmer well-being or farmer mental health in Canada is a priority federally.
Okay.
And from that, CCAW, or the Canadian Centre for Agricultural Wellbeing, was born.
Oh,
So the center was in direct response to a call for action from the research.
oh, fantastic. Okay, I
Mhm.
didn't realize that. There's so
Yeah.
much out there. I know about the study, I know about the results, we hear it, we know about the
Mhm.
impact, but I didn't realize that. That is amazing. And
Yeah.
you are the lead lady on the project. Excellent.
That's right. Yeah, I am. We have a wonderful team over at CCAW, and CCAW was formed just about a year ago. We launched in November 2022. So it's a new organization, but we are motoring. We hit the ground running.
Okay, perfect. So then now here I am getting detail oriented here. Are you guys working with the University of Guelph to do further studies, or did it all move under the Canadian Centre for Agricultural Wellbeing? That's a mouthful.
Yeah, it is a mouthful. So I say CCAW just to keep it simple.
Oh, there we go.
Um, Yeah, yeah. So both. So CCAW has its own kind of plan, strategic plan, and we are a national infrastructure, a virtual national infrastructure. So we work with several provinces and partner up with several agencies, not for profits, universities across the country that need CCAW's expertise to be able to execute some research project or develop a farm informed intervention, to be able to make sure that we're doing something that is A, not reinventing the wheel, and B, that is farm tailored. So, and C, and I would say, all, not most importantly, but equally as important, is that it's evidence informed.
Okay, fantastic. And I know in the beginning when I was doing conversations about the study and mental health, I was sharing resources and it seemed pretty province by province.
Hmm.
Will this help to um, provide resources nationally, streamline? I don't want to say streamline because that's a little bit of control, but is that the goal? Is just to make sure that there's resources right across Canada? Because I know some of
That's
the
exactly
provinces,
right.
yeah, some of the provinces kind of are doing their own thing, which is great,
Yeah,
but all provinces need help, right?
bingo. Yeah, that's exactly right. So I would say it's a yes and. So absolutely. The goal for CCAW is to be able to provide services to farmers for low or no cost across the country. It's also to be able to partner and link in with these provincial organizations that are doing such amazing work already and help them to add to it, not to take away from what they've already been doing. There's some groups that have been working so hard and have huge grassroots support that we just want to help enhance, and we want to link up with them to make sure that everybody gets access.
Oh, I love it. Way to go. Because I know there was some gaps before.
For
And
sure.
and then on the flip side, it's all these organizations have a place and there's no
Yeah,
need to compete, right? Even with my show,
absolutely not.
I'm like, I'm going to have all the organizations on because everybody's voice, everybody's organization is important. Okay, I love that. That makes a lot of sense. So, my next question, unless you have anything to add on the work that you guys do there, I want to talk to you about workshops. I know you guys do workshops for farmers on mental health. And as always, it seems farmers are dealing with a lot of stresses. So I'm curious about maybe two-part question here. What you're hearing from farmers about
Mhm.
mental health, um, those kind of conversations. And then number two is what are your recommendations to farmers on mental health?
Mhm.
Things to do, how to improve their mental health, where to go, all that.
Yeah, sure. So for the first part of your question, yeah, we do speak. What we're hearing from farmers is that things are not easy.
Yeah.
Things are tough. Stress is always high, especially this time of year. Harvest is happening.
Mm.
It is a chaotic time, and farmers kind of function up here for a long time when they're doing harvest. So making sure that we are taking the time to recognize how up here we are during harvest and just acknowledging the fact that that's the way that it is and that's the way that it feels is a huge step forward. Just that minute of self-care of acknowledging, like, I know that I'm functioning up here and I know it's not going to be forever, is a big deal. We're also hearing from farmers that some of the changes that have been happening kind of over the last few years in terms of extreme weather have been catastrophic to their farms or their farm practices. It's changed the way that they've had to farm land that they farmed the same way for many, many years or generations, which can be hard to deal with. We've also heard from farmers that they want to have better mental health. They want the well being of their family to be a priority. They want to be able to access services. They also would like those services to be relevant to them. We did hear some stories, unfortunately, closer to the beginning of our research program, where farmers who eventually went to seek help for severe anxiety, because they thought they were having a heart attack,
Mhm.
and they were told, "Well, take 2 weeks off work," and then they're
Yeah.
marching out of that office like, I'm never going back to seek help ever again. Or they're told, oh, okay, great, thanks for calling. There's a 6 week wait to meet with somebody. Or yeah, so things, big barriers, or the cost is prohibitive.
Yeah.
So things like that are things at CCAW that we're trying to address. And the other thing is farmers have said, I don't know what I don't know. What language do I use? How do I ask
Mm.
my, best friend who I can see is acting differently? How do I ask them safely about their mental health? I don't want to make things worse.
Yeah.
So that's where a workshop like In the Know, we have In the Know training, which is In the Know agricultural mental health literacy. People can take a 4 hour training where they learn all about agricultural mental health literacy so that they can have those conversations and feel confident about what they ask and how to respond to someone who might be experiencing poor mental health, or they know how to recognize some signs and symptoms that someone might be struggling, and what to say. And then, more importantly, how to link them to a service after. So that was something that I would really encourage folks to look into. They can go to ccaw.ca to look for that. Depending where they are in the country, we have partnered up in Ontario. CMHA Ontario delivers In the Know very frequently. And then in other parts of the country, you can go through CCAW to do that.
Okay. Excellent.
And then I forgot the second part of your question. I'm sorry.
Oh, did I forget my own second
I
part?
might have answered both.
I think you did. I asked you
Okay.
about what you're hearing from farmers, what's
And
going
workshop.
on, and what would you recommend. So you got it.
Oh,
Okay.
I have one more
Oh,
thing
please,
to say about that.
please.
Another thing that at CCW we've been working really hard on and is about to launch is we developed a agricultural literacy training for healthcare practitioners. So something that will be kind of CE accredited continuing education for doctors and nurses and mental health professionals so that they can become more literate in agriculture to better serve farmers who come to seek help for their mental health. So they have kind of a bare bones understanding of the specific stressors and how farmers present in those situations that might be different than someone who just lives rurally but doesn't farm or from an urban center. We kind of talk about things like a farmer pain scale that can be a little bit different than a regular pain scale when someone might be a 10, a farmer's saying they're a 4. Just tie my boot tighter, it's fine.
Yeah.
So kind of that's just a very small example and I'm being a bit flippant, but stuff
to-
like that where there's just kind of different language and mannerisms and ways for people who are on the front line for mental health. They don't know what they don't know, so being able to provide them with that continuing education will help them serve farmers better.
Oh, I love that. That is so important.
Mhm.
I as a female, sometimes I'll be a little bit personal here, Briana. Sometimes I feel like I operate stereotypically like a man, right? Women, I'm going to be very stereotypical, but I think there's research behind it. Sometimes women find it easier to connect and reach out and seek help, where men are that, oh, I'm a man, I got to get it done, can't talk about my problems.
Sure.
That cultural conditioning that we always hear about. Sometimes I feel like I operate like a man. And where I'm going with this is majority of my family, they actually grew up around farming, but when they were young. So they're so disconnected. And in the beginning, when we started farming and we were having droughts, and I'm dealing with all that personal stress, and then you go to family functions and they ask how it's going. In the beginning, to be honest, I'd open up and say, okay, this is what's going on. And they would make very flippant remarks like, well, or this,
Mm.
that because they didn't understand. And then it became very dismissive and hurtful.
Hmm.
Myself, I started closing down. So
Yeah.
where I'm going with that is agriculture is unique. Farmers are different. And when doctors and counselors are dealing with them, the fact that they can get training to better understand farmers is great, because I've experienced it firsthand.
Yeah.
Call me that farmer going in for help. I was that farmer trying to open up to my family and really felt dismissed and shut down.
Yeah.
So what did I do? Right. I'm like, okay, not a safe place. They don't get it. I'm not talking about it.
Hmm.
How's that helpful?
Absolutely.
Yeah.
Yeah.
Okay. So mental health is obviously very near and dear to your heart.
Hmm.
And you've shared your long and deep understanding and work in the industry. Can you share why you're so passionate and your hope behind the all the studies, your position? Can you just really, to sum that up, short and sweet, can you share what your hope is with all the work that you do?
Whew. Yeah, that's kind of a big one, but I think
Can of worms. Open it right
such a
up.
can of worms. But I
Yeah.
think, like, to put the first thing that comes to my mind is we should all be very passionate about making sure that the people that feed us are well taken care of. And if farmers are not in a state of mental well-being, then they're not able to sustainably produce the food that we need to survive. So everybody should care about this as much as I do. Um, so I just feel like I'm so grateful for farmers and the farming community, and I have a specific skill set around mental health. So this is what I can contribute back. So I absolutely should be doing that.
Beautiful. Could you imagine another thing I like to do? You have those forks in a road and you make decisions to do one thing or not. Could you
Yeah.
imagine? I don't know if you had the option to say no to the study or whatever it is, but could you imagine if you had said, yeah, no, I don't want to be part of that? How different your life would be?
Uh I can't imagine how different
I
it would
just
be.
love, I'm
It
putting you
would
on the
be so
spotlight.
different,
Yeah, yeah.
and I can't imagine being in a role that's different than the one I'm in now. And you're totally right. It could have taken a different path at some point, and I'm so glad that it didn't, because there's a lot of work to be done here.
Love it. Sorry for putting you in the hot seat. And it's
Not
funny,
at all.
I realize I'm doing that. And the same thing happens to me. People ask me about building my company. I'm like, you just do it. I'm not thinking about
Yeah.
it. Right? You
Yeah.
just do it. So sorry about that, putting you on the hot
Not at
seat a few
all.
times. But maybe I'm doing that because I'm on the outside and you're on the inside. You're the person doing it. It's your day in, day out. You hear the stories, you're part of it. I'm a little more on the outside and looking at you and your roles and all the organizations and realizing what a huge impact it's had. It started the conversation, it's
Mhm.
changed the conversation. So if I put you on the hot seat, it's not to put you on the hot seat, it's maybe more to just say, kudos, Briana. Kudos to
Oh,
you, Dr.
it's certainly not.
Andrea. My goodness.
Yeah. It's
Yeah.
certainly not just us, and there has been a massive farmer mental health movement in Canada, and it's continuing to grow. And like, I also want to shout out these provincial organizations that are running mental well-being programs or counseling through, small groups that are doing it really well. And there's several provinces that have really stepped up to try to do what they can, and I think it's amazing.
Wonderful. Okay, I'm going to get you to do a final shout out on where farmers can find resources and maybe any final parting words that you have for farmers that might be sitting there that are combining their crop and there's hardly anything there because they're 5 years into drought.
Mhm.
Maybe share some parting words of encouragement, and then go into resources and where farmers can access more information and help if they need it.
Yeah, absolutely. So, uh, I guess parting words, I would say that everybody experiences their highs and lows, and knowing that you can go seek help for your mental health in a way that can be really helpful for you as a farmer is something that I would encourage you to try. And if you don't find the right fit the first time, try again and know that you can talk to somebody. You can reach out to help formally, or you can reach out to help from a neighbor, or from a family member, or you can go to CCAW's website and we can connect you with someone. And depending where you are in the country, your services are going to be a little bit different. If you're in Ontario, there's the Farmer Wellness Initiative that you can call into. If you're in Manitoba, there's the Manitoba Farmer Wellness Program that you can call into. If you're in Saskatchewan, there's the Farmer Stress Line. So based on your province, there's going to be a different resource. Out east, they in PEI, they have the Farmer Assistance Program. I know I'm probably forgetting one, but to look for resources, there's an organization called Agno that has a list of resources. Do More Agriculture has a list of resources on their website. You can connect with us at CCAW through our website, which is ccaw.ca. And I think if you go, lots of farmers like to use Twitter. And if you go on Twitter, you can search any of those and find resources. So I would really encourage you to give it a try.
Wonderful. Thank you for sharing the parting words and resources. And I want to do one more final thank you to you,
Oh,
your team, and everything you guys have been part of. Obviously, the work you're doing is important, but it's easy to get caught in the day to day. So kudos,
yeah,
thank you. If you ever for 1 second doubt how important it is, let me remind you right now that it's important and farmers are grateful. So thank you,
thank you,
Briana.
Tracy.
You're welcome.
Thanks so much.
Thank you for joining me on the show, and you in the audience.
Anytime.
I love it, love it. And maybe we'll have to do part 2, or when you have a new
Sure.
story come out. Just keep in touch
Mhm.
because, as you know, as we all know, there's always stuff going on.
Yeah,
Drought, too much rain out east. So I'm trying to have more and more conversations about mental health too. So keep me in
awesome.
mind if you ever have a message to spread. So thank you,
Absolutely.
Briana. You in the audience, thank you so much for tuning in. If you enjoyed this and found it valuable, please like it, share it, comment, rate the podcast. Everything you can do to spread the word helps our show, but most importantly, helps our farmers with their mental health and having a healthy, happy industry. So thank you and see you guys next week. Bye-bye.